Good morning, everyone, and welcome. Thank you so much for being here. My name is Zainab Farali. I am the Communications and Research Development Manager at GPS. Excuse me. I am joined here today by my colleagues, and you'll hear from throughout today's conversation. But before we begin, I want to share a little bit about how today will feel. This is meant to be a formal. This is not meant to be a formal presentation where we talk at you. We really want this to feel more like a conversation, a shared moment of reflection. So we'll be talking with each other, building off of one and telling stories alongside the data. We'll also have time for questions at the end, but please know that if something resonates with you or if a question comes up along the way, you're welcome to drop it in the chat or gently jump in. This is a community space, so please don't be shy. And before we dive into the year and the work, I'd like to invite you into a brief moment of reflection. I invite you to take a moment and think about this question. Who supported you or who do you wish had supported you during a major transition in your life? It might have been a moment, a parent, a friend, a mentor, a healthcare provider, a community member, or maybe it's someone you wish had been there. And you don't have to share this with anyone. Just hold that person or that moment gently in your mind as we begin. At Global Perinatal Services, we exist to be that support, especially during moments of transition that can feel overwhelming, uncertain, or isolating. Pregnancy, birth, and early parenthood are some of the most profound transitions a person can experience, and no one should have to navigate them alone. Today, we'll reflect on 2025, a year that asked a lot of our communities, and share the stories, the impact, and lessons that shaped our work. We'll also look ahead of what's next and how this work continues to grow in response to the needs of families. We're really grateful you chose to spend this time with us today, and so we'll begin. Now that we've grounded ourselves, I want to take a moment to name why GPS exists. Global Perinatal Services, or GPS as we refer to it, was created to address a clear and persistent gap in care. Often pregnancy and parenting systems are not designed for Black, immigrant, and refugee families at the center. When care isn't culturally responsive, when language, lived experience, and trust are missing, families are left navigating some of life's most important transitions without the support that they deserve. Our mission speaks directly to that gap. Our mission is to create culturally responsive pregnancy, parenting experiences for Black, immigrant, and refugee families. That mission guides how we design our programs, how we partner with communities, and how we show up for families every step of the way. And our vision reflects where we're going. Our vision is that every mother and baby survives and thrives through pregnancy, labor, and beyond. Not just survival, but thriving across systems, communities, and generations. This mission and vision are the foundation of everything you'll hear today. They set the context for the work we'll walk through next. And this slide shows the range of programs GPS offers across pregnancy, birth, and early parenthood. You'll see the names of our programs here, but what's more important isn't the list, it's how they connect. And families don't experience care in pieces. They move through pregnancy, birth, and parenting in real time, often with changing needs. And our programs are designed to meet families at different moments and to connect those moments together. And some families may first come to GPS through Doulas Services. Others might start at Easy Access Clinic and a support group or through lactation support. Wherever someone enters, our goal is to wrap care around them and not hand them off. Each of these programs reflects a different point along the journey, but they're all grounded in the same values of trust, cultural responsiveness, and relationship. We'll dive deeper into a few of these next, but we wanted to start by showing the full picture of how care is woven together at GPS.
I just wanted to add, Zainab, to that slide,
Yes.
that it's also just as important for us to make sure that the person those services are coming from are also people that look like the communities that they're serving. So that is a key ingredient at GPS. We want to serve the communities. We want to give communities tools to serve itself. So in all of these programs that you're looking at, we deliver in the person's native tongue as well.
So, thank you. This slide shows the languages spoken by families we serve in 2025. And what this data really tells us is that language access isn't optional, it's foundational to care. When families can communicate in their own language, they're better to able to ask questions, understand their options, and make informed decisions during moments that are often emotional and high stakes. The diversity you see here is exactly why culturally responsive care matters. It's not just about translation, it's about dignity, safety, and trust. Language can be the difference between feeling confused and feeling cared for. This data directly informs how we hire, how we train, and how we design our programs so that families don't have to adapt to the system, but rather the system adapts to them. And I want to take a moment to talk about our support groups and what participants have shared about their experience. Based on post-session feedback from 2025 support groups, parents consistently told us that these spaces help them feel more emotionally supported, more confident in their parenting, and less alone. And what stands out to us is not just the groups were helpful, but how meaningful they were during the season of life that can often feel isolating. And one parent shared, quote, "Since joining this group, I felt more supported, less alone. Hearing others share similar challenges and victories helped me feel seen and validated," end quote. And another parent told us, quote, "I feel more supported emotionally, clearer mentally, and more confident in my parenting. It's helped me feel less alone and more capable overall," unquote, end quote. What I hear again and again in both in this feedback and as a facilitator myself is that these groups create space for connection, reflection, and growth. They help parents try new approaches, feel more confident in their decisions, and release guilt that often comes with needing support. This kind of impact isn't always captured through large numbers, but it's deeply meaningful and it continues to shape how we design and hold these spaces for families. And this slide offers a snapshot of our support groups and how they shape this year. You'll see our three core groups: Mom's Corner, Father to Father, and Afghani Sisters Corner, each created intentionally to respond to the needs of the communities we serve. What's important to note is that these groups are not prepackaged or one size fits all. The topics you see here were shaped directly by participant feedback and requests, and parents told us what they wanted to hear or to talk about, and what they were navigating, what felt urgent in their lives, and we built the spaces around that. And in many cases, these groups became one of the few spaces where parents felt that they had agency over the conversation. That's why these groups feel relevant and trusted, and people showed up and they kept showing up because the conversations reflected real experiences. These groups represent what becomes possible when support is designed with community rather than for community. And they reflect what we've been able to sustain and grow through years of change. And now with that, I'm going to hand it over to my colleague Akua, who will continue to share about our doula programs.
Thank you, Zainab, for that beautiful overview and introduction. Good morning, everyone. My name is Akua, and I'm the doula program manager at Global Perinatal Services. I come to this work as a first-generation Ghanaian American raised by a family of resilient matriarchs. Growing up, I heard stories of women in my family giving birth in Ghana, surrounded by community and support, and later experiencing isolation and mistreatment after immigrating to the United States. At Global Perinatal Services, our doula program restores culturally congruent, compassionate care to the birth experience and supports people through a major transition in their life. So here's just a small snapshot of our doula program. In 2025, we continue to expand our doula workforce and our reach across Washington State. In 2025, we also ended with a total of 29 doulas in total, including 27 contract doulas and two community-based doulas. Our doulas also serve in total 21 languages. So we have a really broad reach in the languages that we serve and the communities that they come from. Primarily, we serve three counties in Washington, including Pierce County, King County, and Snohomish County. And we are also really proud that we have been reimbursing doulas through Medicaid since the summer, about June 2025. And while the expansion of Medicaid coverage for doula services has brought its own unique challenges, it has also increased awareness of the doula profession. And I still get really excited when people come into the office and, they ask, what is a doula? Or I'm talking on the phone to a new person and they're asking what a doula is, and I get to explain that for the first time. And some people are also matched with a doula for the first time in their pregnancy. So it's just really exciting to continue expanding awareness about this profession that is actually not really new. It's been in our communities and it's been in the birth work field for many, many years, but now it's being kind of more recognized and expanded. And this slide showcases our clients enrolled in various programs per month. On average, we are enrolling about 30 to 45 clients per month in our birth doula program. And for each person that comes in for any type of program, whether it be the birth doula program or our community-based doula program, or even we have a postpartum doula program, we are speaking to everyone one-on-one to explain the different programs that we have to see which one best fits their needs. And we're also trying to figure out which one best aligns with their needs. And what's special about our program is that we are tailoring our doulas to our families and to birthing people based on their cultural background, ethnicity, and language preferences. And so we always ask people if they have any preferences with language or the cultural background of the doula, because we know that culturally congruent care is a key part in having a, culturally congruent birthing experience.
I just wanted to add real quickly, Ikwa, for those people who are not aware of what the difference between the two programs are. So the birth doula program is the traditional doula program, which usually is somebody gets matched towards the end or the last trimester of the pregnancy. And the doula helps assist the family with the birth. Possibly they meet with them during prenatal and then once or twice during the postpartum, and it's done. The community-based doula program, this program is a program that we actually are accredited site for. It is a nationally identified model, and what happens with this program is a lot of emphasis is put on home visits, on preventative aspect of things. So the doulas, the reason why we only have two doulas here is because they are full-time doulas and they have caseloads like the Family Nurse Partnership similar to that program. So they have about a caseload of 12 to 15 clients at any given time. And they do about a birth or two a month, these doulas, but the home visit is where the emphasis is put on. So that is a difference. And we implemented this program back in 2018 with the Somali community because there was a crazy amount of cesarean section happening within that community. And we wanted to sort of see if this would be particular program would be impactful, and it has been. So that is the difference between the two. Community-based doula program, the client enrolls in at 28 weeks pregnant, or less even and they stay in the program up until baby's first birthday. So that is the difference between the birth doula and the community-based doula program.
Thank you, Faiza, for explaining the difference. And this slide shows some data on the number of births by month for our two programs, our birth doula program on the left and community-based doula program on the right. Just an overview for our birth doula program, we had about 297 births. And for our community-based doula program, about 20 births. So just when you think about it, if you think about like a kind of an average graduating size class for a public school, it's about 300, anywhere from 200 to 300 students. So we're literally birthing the next generation of young people, which is really cool to think. And our community-based doula, it's a kind of a small class size. So that kind of helps give you some perspective on the amount of births that we're doing yearly. And I also really wanted to emphasize here that among these births, 160 identified as first-time parents. And often people seek a doula after experiencing a traumatic birth experience. But in this case, our work was preventative. By providing doula support upfront, we help to mitigate or prevent some negative traumatic birth experiences for first-time parents.
That's amazing. And thanks for the analogy, small class, large class. I love that.
And this next slide showcases a breakdown of the method of deliveries for live births among our two doula programs. And most births overall were vaginal deliveries for both our birth doula and our community-based doula program, with about 67% for our birth doula program, 65% for our community-based. And then when we look at our C-section rates, when we combine our planned and unplanned C-section rate for our birth doula program, it's about 31%. And for our community-based doulas, when we combine planned C-section and unplanned, we're looking at about 35% for C-section rates. And these numbers are also kind of comparable to our state averages. Um, and when we're looking at our community that we're working with, a lot of our clients are from Black, African American, or immigrant backgrounds, and so they already experience a compounding challenges with immigrating to the U.S. and navigating birthing here. So it's really great to see that a majority of people are delivering vaginally. And then for our NICU admission rates for both of our programs, they were relatively low. Most people were not admitted to the NICU for both our birth doula and our community-based doula program. And then when we were looking at breastfeeding initiated at birth, again, most people were initiating breastfeeding at birth. And these breastfeeding rates are really a testament as well to our comprehensive lactation support that is offered at GPS. Um, we have a we have more slides to discuss our lactation support, but we have one-on-one consultations. We have two IBCLCs who are able to provide lactation education. We also have people who can come, any Washington State resident can come in and walk in anytime into our office and receive lactation support and education. So these numbers are really a testament to the wraparound support offered at GPS. And then lastly, when we're looking at our preterm birth rates, here we really wanted to highlight how both programs have really great full-term birth rates and low preterm birth rates, but especially our community-based doula program on the right-hand side, we can see that 100% of births reach full term. And that's really amazing. This really showcases the power of one-on-one continuous support that our community-based doulas provide to birthing people. throughout the entire perinatal health period and beyond. And now that we've discussed our data for our birth doula program, I would like to pass it on to our founder of GPS, Faiza Farrell, to discuss lactation.
Hi, everyone. Thank you so much, Ikua, for that. Lactation is oh, at GPS, like Ikua was saying, we put prevention. We we believe in prevention, right? And one of those preventions is that we want to make prenatal lactation readily available to our clients and also to the community. Which is why, like what was saying, we are at the office on Tuesdays and Thursdays, and we have somebody who's actually there for 5 hours. Just anybody can come through, ask questions. We also have lactation hotline, which when was it? We created the lactation hotline about 3 years ago. But then again, a couple years ago, we actually got the funding to push it forward. And we have been really, really successful at that. And again, this is for across Washington State, that anybody can call and get lactation assistance over the phone. And if people are in King or Pierce County, then we can actually do a home visit as well. And our home visits usually are within the first 3 days of the birth. And again, I'm a licensed midwife by trade, and one of the things I've seen is like the challenge of somebody. There are two things. First of all, it's like lack of prenatal education because you can't just have somebody who just gave birth, God knows how long they've been laboring, and then all of a sudden you're like, how do you want to feed your baby, right? And so it's important that this person has knowledge of what their body is going to be going through after giving birth, right? So we really take our time during that prenatal phase to educate folks of what to expect those 3 days, because very, very crucial, because oftentimes people feel, I don't feel, my breasts don't feel full enough, therefore baby's crying. I need to feed the baby. So our lactation education specialist explain to our clients or our community what's going on and why it's important to feed your baby, even though you don't feel full, right? Very, very essential. And as if you could go to the next slide, Ikua. We don't only do prenatal lactation education, we also, or the hotline, we also help folks with, like I said, the home visits. Unfortunately, home visits right now, we can only do one per person. Again, the time that we see it is like within those first 3 days. If they're in the hospital, they're in the hospital. Once they get home, that's when the complications or questions arise for folks. So we are able to dispatch and have our IBCLCs go do the home visits for these folks. Again, we've seen significant, just at the attitude of the breastfeeding person changes when they have this like wrapped around services, right? And I know a lot of programs throw around the word wrapped around, but at GPS, that's exactly what it means, right? So we are able to provide, and later on we'll talk a bit about this too, easy access clinic. So this is people who are wanting prenatal care in a very relaxed environment where, they can get their questions answered, right? And then we connect them to the IBCLC for them to see before after their appointment. They see ECUA for doula services, right? If they've given birth already, we have them reach out and then we can connect them to a postpartum doula. So this is it's it's very dynamic. It's something that's moving at our programs. That's what makes our wrapped around services different is that these components are moving like as the family's needs change as well. So we try to remove all barriers to services, which is why again you can fall into anywhere. If your baby is 6 months and now you are wanting an IBCLC person because you want to go back to work or whatnot, you can still call up on our IBCLC hotline or pop in the clinic to ask them questions. The other thing that we help folks with is helping with breast pumps. During the Obama administration, this was something President Obama made into a law, basically signed into a law where people have access, the insurances pay breast pumps for folks who are wanting to breastfeed. So, and our clients, we educate them, and almost everybody wants to get a breast pump, right? And we help them with that as well. And then we have for our doulas, most doula training programs. I've trained doulas, in the past. I still do. The doula training programs, the curriculum, it just doesn't include a lot of time with like breastfeeding training, right? So because of this, we have this mentorship where one of our IBCLC actually does a specific topic, case studies with the doulas, and this is open to the community, not just GPS doulas. Everybody can come through, and she goes through these sessions, case studies, and all that stuff, which I highly recommend. This is just provides continuous education for the doulas, and also if folks are thinking about getting their CLC or Certified Lactation Consultant certificate or want to do IBCLC, this is a great pathway for that as well. Because we do want to see a lot of brown and black folks who are getting, higher education in the breastfeeding sector as well. So these are the programs under our lactation services, and these are the numbers, as you can see, how many calls we've taken or how many contacts we've made for the hotline, and the in-person sessions, and all that stuff. You can see those as well. Next slide, please. These are some testimonials. Literally, we pulled this from our electronic medical records to showcase what people are saying once they get that support from our IBCLCs via the hotline. And you can read that for yourself. Next slide, please. Perfect. Case management. We have an Afghan, one of our Afghan doulas is a case management as well. She does case management for the Afghani folks. We created this position, piloted when in, I believe, 2022. This is when the influx of the Afghan refugees started coming into our country, into our state specifically. And we had teamed up with the King County Resettlement folks at the time. We actually started providing services in the hotel that the newly arrived refugees were staying, and we were fortunate enough to actually hire somebody from that resettlement, and hired her as a case management person, and she's done a phenomenal job to help pregnant folks, their families navigate the system, which is, as you can imagine, being in a new country and then birthing in a new country for the first time, it's really, really scary. So she, with our support, she has helped make things a lot easier for people in this community. Again, not just birthing, but also connecting families to ESL classes, helping families sign up school for their kids, even unemployment, ordering birth certificate for the children. Just there's a lot of things that this person does than just attending births, and it's been really, really great to see somebody, just to name someone for that specific community, and then see this position blossom into this beautiful partnership between us and the Afghan community. Next slide, please. And these are the enrollments of the program just within this is again just 2025, this data. So 77 enrollments Sadoba has had, and then she has made over 200 referrals into the community as well. So which again is for us 2025, one of the things we really wanted to push forward was creating partnership. We actually put together our strategic plan in mid 2026, 2024, I should say. And one of the things, our strategic plan is actually on our website if you are curious and want to check it out. But one of the things we really wanted to do was to form partnership with other organizations. This just makes handoff a lot easier for our clients. And and it's really beautiful to see that this many referral just for this one program. Again, our community-based doulas our birth doula, program manager makes referrals on a daily basis, but this is just a slice of what the case management has done for the Afghan community. Next slide, please. The Easy Access Clinic, again, this is another model, national model that we have implemented at GPS. And it is the Easy Access Clinic, the point is to make things easy for people. So if somebody is, and we provide comprehensive prenatal visits, and the person can either just come once in a while. If they're concerned about their baby movement, for instance, they can just come in instead of going to urgent care. We can check that out for them. Or if they are wanting to check their blood pressure because their provider has told them to do so and they don't have the blood pressure cuff at home, they can pop in. Or if they want us to actually provide comprehensive prenatal care, they can too. So the whole point is to remove barriers for pregnant individuals. And that's exactly what it does. Our initial visits are an hour long, and then our follow-up prenatal visits are half an hour long. So we do blood work, we refer folks for ultrasound, and all those things. And if somebody wants to go deliver at the hospital, they can. We send all of their records there with them. Or if they want to deliver at the birth center, they're able to do that as well. So that's what the Easy Access Clinic is. Again, we're there on Tuesdays and Thursdays. If somebody has an appointment at 9:30 and then they show up at 10 o'clock, we still see them. We don't turn anybody away at all because again, we realize just some of the barriers that our families are having to navigate, and we don't want to make getting healthcare that much difficult for them either. So it's not like you're 10 minutes late, your appointment is done, or three appointments and you're out of the system. It doesn't work like that. That's not the way healthcare should be delivered to human beings, and that's exactly what we are doing at the Easy Access Clinic. Next slide, please. This is the data from our Easy Access Clinic. So the patients that received services in 2025, there were 349 patients, and then the number of appointments that we've had were 490. And then, of course, clinic days, 97 clinic days we had in 2025. Next slide, please. Dental program is one of our newest programs. We were fortunate enough to partner with Arcora last year, and they made the dental program possible for us basically because research shows there is a correlation between dental complications and preterm. So one of the things we really wanted to do was to make sure that pregnant folks are during that postpartum within that 6 month that they were able to get in to be seen at least once, either during the pregnancy or during that postpartum period. And we were able to, right now, it's, I think just this morning it was like 104 or something like that. So our goal was to basically get 100 pregnant individuals to get in to be seen by a dentist during the pregnancy or that postpartum period. And of course, we've had more than that number. And we also, one of the things that was making folks really difficult to be able to get into dentists, especially people who are Medicaid recipients, was the fact that a lot of dental clinics do not take Medicaid. So we really worked really hard in partnering with dental clinics that throughout King County that accept Medicaid. So that way, when our clients call or when we call on behalf of our clients, it's a lot easier for them to get in. So we were able to do that for them. There were some people that had issue like with transportation, and we were able to send Lyft for them to go and get that done. So again, we are doing anything and everything to try and move any barriers for folks that we serve or people in our communities, because getting a healthcare there shouldn't be any barriers for anybody to get the healthcare that they need. And that's exactly what we try to do at GPS. I just wish that we as a country, we were doing that. But at least this is what we are doing. Like, this is us doing our part at GPS. Next slide, please. GPS doulas, it is a certification body. So this is kind of like a sister chapter to our programs. And what we are trying to do, again, this program is about 3 years old. And what we do is make sure that there is a certifying body for doulas who are wanting to be certified. Nationally, there is one certification body throughout, like like in the US and also internationally. So we are trying to do something similar to that, but making things a lot more accessible, removing barriers for even doulas who are trying to be certified. There are a lot of hurdles with these other organizations. So we try to remove that while still keeping and upholding the profession of doulas, because to us, we want our doulas to be very professional so that way the families that they're serving are getting the best of everything. So we try to, hold doulas a space for them too. That's what the certification body is. Even those who are not GPS doulas per se, just within the state or even out of state, we try to hold space for them. We try to also mentor them as well, in any way that we can. So the certification body now will also be offering continuous education. So our website is actually down now. If you go for the doula, for the GPS doulas, because we are going through some what do you call renewing the website to make sure that that component of CEU is also available there. Next slide, please. These are the folks that, just the numbers for this particular program. We had provided, like Ekua was saying, our state implemented the Medicaid doula reimbursement program January of 2024. So it took us quite some time to provide plenty of TA in helping people because the implementation was a bit of a mess than we had envisioned to be. So we literally had to sit with each and every one of these 19 doulas to help them go through the process. There are like 3 different processes that each doula needs to go through in order to become Medicaid eligible doula. So we've helped provided technical assistance for 19 doulas and still doing up to this date for new doulas. We had certified 9 doulas, and then also we had trained 12 more new doulas in 2024, in 2025, I should say. The year is going so fast that I don't even know what year we're in, honestly, sometimes. Yep. Next slide, please. Okay, I think, is this still me? I think still me, yeah?
Yes, that's still you.
Okay,
Yeah.
perfect. Yeah. So comparison data, we are comparing. If you could go to the next slide. Oh, by the way, this beautiful photos were done. We partnered with BSK in 2024 because BSK is Best Start for Kids. If some of you don't know, and we had they really wanted pictures of Black and brown families. And so they reached out to us in wanting to partner with us. So in 2024, fall of 2024, we invited a bunch of our families. They came, and these pictures are actually pictures of our actual clients, which is really cool. So yeah, just wanted to give shout out to that. So this is comparison data for 2024 and 2025. For us, as you can see, there's been a significant jump in how many, basically the enrollment and also how many clients we were able to serve. And this is what we were anticipating that the Medicaid reimbursement would allow, because when you are based on grants, you are literally constricted oftentimes. But now that, again, 99% of our clients are Medicaid recipients. So this is what the attribution of the jump is what I would attribute is the fact that that now we can serve more. Now each doula can serve up to 4 clients a month if they have the capacity for. So as you can see, just the numbers are like for birth doula 2024 we served 298 the enrollment, and then in 2025 it's 417, and we are anticipating that number to just grow as for this year and on as well. So yeah, this is just a comparison data. You can take a look. I'm going to go ahead and pass it over to Dua, our researcher.
Hi everyone, my name is Dua. I'm a public health researcher at Global Perinatal Services, who focused on maternal health equity and advocating for new policies in Washington State. So, 2025, it was a year of building, strengthening our research, training, and systems to deepen impact in 2026. Our current project, it was about bridging the gap in postpartum care across Washington State by integrating community-based resources into postpartum hospital discharge materials. The main purpose of this project is to advocate for a more inclusive and effective postpartum care system that meets the unique needs of diverse families in Washington State, especially BIPOC and refugee and immigrant communities. So what we did, we reviewed the 6 major postpartum hospital discharge folders statewide. And from this review, we identified gaps in culturally responsive postpartum resources. And we also conducted a multilingual community survey to create a more inclusive and supportive resources for diverse families. And we also conducting an ongoing literature review to re-inform evidence-based recommendations for stakeholders. And we also have an upcoming community organizations information session that give other organizations an opportunity to partner with us on this project. So our key findings from this project shows that postpartum discharge materials across Washington State often lack culturally responsive, community-based resources, which create a missed opportunity to connect families with vital postpartum support. Next slide, please. And we have 2 incredible public health interns who were instrumental in this project. They are Mallory from University of Nebraska and Aimer Ray from University of Washington. Thank you.
Yep, of course. Thank you, guys. And hopefully my computer doesn't pull a fast one, but we are in the last few slides. Thank you so much for hanging in there with us, guys. So I just wanted to take a moment to share more about our Doulas On Demand program. And at GPS, we hold a simple but deeply important belief that no one should birth alone. And yet we know that many families arrive in labor without a doula, not because they didn't want the support, but because timing, access, or system barriers made it difficult to connect earlier in pregnancy. And we created the Doulas on Demand to respond to that reality. This program allows laboring individuals at hospitals and birth centers to be at hospitals, at birth centers to be connected with a skilled, compassionate doula when support is needed the most, even if that connection happens during labor. It's through 24-hour availability and close coordination with labor and delivery teams. A doula can be assigned and join the client within hours, and that's a game changer. What matters most isn't just the logistics, it's what that presence makes possible. That support helps create continuity, choice, and dignity at a moment that can feel intense and vulnerable. For families, this moment of support becomes the beginning of a longer relationship with the option to continue care with their doula after birth. This program has been a game changer, as I mentioned, in how we think about access to birth support, especially for families who need care in the moment and not months in advance. It reflects how we respond when we see a gap in care, with urgency, intention, and community at the center. And now, my favorite part of our presentation is as we look ahead, we want to invite you into what's coming next for GPS. As we think about 2026, these goals reflect what will take to deepen our impact and respond to what communities are asking for next. One key focus for us is strengthening our fundraising efforts so we can sustain what's working and grow into what's needed. And we're also committed to expanding research and learning research and learning, ensuring our work continues to be responsive and community informed. Another priority is increasing speaking engagements, allowing us to share what we're learning and help shape broader conversations around care. And finally, we're excited to grow our CEU, or continuing education opportunities, supporting doulas and care providers with ongoing education rooted in real-world practice. Together, these goals point toward a stronger, more connected future for GPS. And before we move on, I want to pause here because one of these goals is connected to something we're especially excited to share. And we've been very intentional about when and how we share this. And we wanted this community, the people who show up and support this work, to be among the first to hear it. So with that, I want to share what's up next for GPS. And yeah, so I want to share at this moment, to share what the next chapter will look like in a very real way. As many of you know, 2025 has been a challenging year for community-based organizations. Funding landscapes have shifted, and many programs across the country have been impacted. And through it all, GPS has worked hard to sustain our core services, continuing to show up for families when consistency mattered the most. But we also know that sustaining alone isn't enough, and communities are asking for more access, more responsiveness, and more culturally grounded care. And meeting that moment requires investment. And so that's why we're launching a $1 million community fundraising campaign with the goal of reaching it by October 2027. And this campaign is more than about fundraising. It's about ensuring that programs like our support groups, Doulas On Demand, and community-centered services remain available and can grow. And we want to be clear that participation doesn't have to look one way. Some people may be able to give now, and others may choose to pledge today or share our campaign with their group, their network, or help connect us to new supporters. What matters most is staying connected and moving forward together. And this work has always been powered by community, and this next chapter will also be too. And so I just want to pause here for a moment, and everything we've shared today, the stories, the programs, the growth, the resilience, has been made possible because people chose to walk alongside the work. And this campaign isn't about a single moment or a single shift or a single gift, excuse me. It's about ensuring that families continue to feel supported during some of the most vulnerable and transformative moments of their lives. We know that support looks different for everyone. Some of you may feel moved to give today, and others want to make a pledge. Like I mentioned, either today or some other time. Some may choose to donate through our donor advised fund or to share this campaign with their community. What matters most is how you show up, and that's the way you stay connected. And this is a multi-year effort rooted in trust, care, and relationship, and we're inviting people to join it in ways that feel aligned, meaningful, and sustainable. However you choose to engage, please know that it makes a difference, and this work continues because of community. And I just want to thank everyone for being a part of this moment with us. And if you'd like, we invite you to stay connected. As we close today, we want to thank you truly for being here and for spending this time with us. Everything we've shared today is rooted in relationship, and this final slide is simply about staying connected. Whether you're following us on social media, visiting our website, reaching out with a question, or sharing work with someone who might need it, all of that matters. And you'll see here our intake form and referral information. And if you're a provider or partner or community member who may want to refer a family for our services, that option is also available. And so, yeah, we're so grateful that you could join us today. So thank you so much for being a part of this conversation.
We've got like 3 minutes. Does anybody have any questions for us about anything? This video, along with others from previous years, it will live on our website as well. So if you like, probably later this week, we will post it up there too. And yeah, we've got really lively YouTube channel too, if you want to check that out as well. Yeah. Thank you so
Thank you
much for
so
being here,
much for
everyone.
sharing. It was really amazing to hear about the great year.
Absolutely. Thank you, Diane. Thanks, everyone.
Okay. Have a nice day, everybody. Bye.
Thank you, Catherine. Yeah. Bye.
Take care. Bye.
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 Mhm.
Great job, Zainab and Ekua.
Thank you, Faisal.
Yes,
Great
that
job
was
as
great.
well. Yeah.
Yeah, yeah. Awesome. All right. Well, I will log off.
Okay.
See you guys later.
Bye, guys. Thank you.
Mhm.
Bye.
Awesome.